see Arbonne products, you can click on the Arbonne link. Those are soy-free, vegan products that you can use every day, different items. So you can go there and just start having fun, just play and surf. Also, the producer of the show is T Jams. That's TJAMZ. And you can reach him at tjamsmusic.com. There he has a list of songs you can write lyrics to. You can send him a message. You can also call him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now let's get down to why we're here. So, we're going to do the update on the coronavirus. I've gotten my references from Cal OSHA, also at www.dir.ca.gov/DOCH/C coronavirus-info-HTML. Also from the CDC website, which is the Center of Disease Control and Prevention. Also got it from the Worldometer, which is where I usually get my statistics on the current cases and deaths across the world. Also, I have information I retrieved from the U.S. Today News, also from the CEBM, which is the Center of Evidence-Based Medicine. Now, the current updates of the coronavirus, based on the Worldometer, as of Sunday, which is today, a few hours ago, because it keeps changing, sometimes hour by hour. So worldwide, we have 1,261,379 cases. Deaths, we have 64,474, and 206,036 patients have recovered. Now, the U.S. is now leading the cases. They're beyond China. China was 81,000, but I don't really believe their numbers anyway. How's it that all of a sudden they're stopped? So I don't know about theirs. So the cases currently in the U.S. is 331,497. Now, Italy has less deaths, but they have less cases, but they have the most deaths. They have 15,887. Now, the majority of the people with COVID will get mild symptoms of cough and fever. Now, the World Health Organization on March the 11th declared this a pandemic because it's worldwide. The first virus was reported in Wuhan, China. This was December 2019 that we know of, which probably I kind of think it was way before that. It has spread to 208 countries and territories, and it's in 2 international countries as well. Now, the coronavirus is a severe acute respiratory syndrome virus. It's bi-coronavirus, beta coronavirus, like MERS, which is the Middle East respiratory syndrome. Also, they all originate from bats. Wuhan, China first they linked it from animal to person, then it became no person to person. So yes, it's person to person. This is what's going on because now it left China and has come everywhere, including all of the United States. So it's everywhere now. Trump said it was a Democratic hoax. Well, it's everywhere, folks. No longer a Democratic hoax. Okay, so you have any symptoms from mild to death. Now, who's vulnerable? The people that are more vulnerable are 65 years old, people with underlying health conditions like heart disease, hypertension, chronic respiratory lung disease, asthma, kidney disorders, cancer, autoimmune suppressive disorder. Obesity is another factor as well. They said it tends to, it makes it harder for your lungs to expand because of the weight. So now that you have the free time, start working on some of that exercise and eating healthy. Try not to eat unhealthy. And we'll go through some healthy tips later at the end of the show. Also, diabetes is another part of the high-risk group. So those of you who have those things, you have to really self-monitor. You need to self-quarantine like myself. I have it too. I have the lung portion, so I have to self-quarantine. Please follow the instructions. Take this serious. People are dying. Now, there is still a shortage of test kits, even though on March the 5th, according to the LabCorp, they said that there will be more tests available. Well, there are not enough tests available at this time. And even if you were to be tested, your doctor has to decide if and when you to be tested, because we still have a severe shortage. So I would suggest for you to call ahead and not just drop in line, because you may be wasting a lot of time and you may not get tested. If you don't have a doctor, please call 211 so you can get a provider, because you're going to need a prescription before you jump into the line. Now, unfortunately, we have some thieves in this world who take advantage of people's misery. So some people are still charging different patients $200 to get the test, which is inappropriate. I suggest if you had to pay for it, keep your receipt and send it to your insurance company. Now, a lot of times if you have coughing, sneezing, fever, or shortness of breath, sometimes that won't even give you a guarantee to be tested. So hopefully we're going to get more testing so people can get tested sooner. But like the public announcer says, if you think you might be COVID positive, then still quarantine yourself. Stay protected. Now, healthcare workers, we're supposed to be tested. You know, we should be a priority, right? Because we're working with patients every day. We're seeing patients who are actually infected every day. Oh, but guess what? It's still unfair. No matter what, the rich always get things first. Some kind of way they can find tests whenever it comes to the rich. Or even our president, he got tested. He didn't even have symptoms, but he got tested. So the rich always has the privileges, which is very sad and very unfair. Now, on 3/30, according to Governor Newsom, the one thing he did say is that nurses will be laxing their ratios. That is absolutely not true. We will stick to the standards for ratios, meaning nurse per patient, like ICU. It's one nurse per 2 patients. Anything more than that is not safe for that nurse or the patient. So we will not be doing that. I like everything else you say, Governor Newsom, but not that. Now, per the New England Journal of Medicine, aerosol and surface stability SARS, which is the COVID, and then we have the COVID-1 as well, they can remain in the air. They can remain on plastic, stainless steel, copper, and cardboard. Aerosol can last up to 3 hours, meaning in the air, up to 3 hours. And then plastics can last up to 72 hours. Stainless steel is 48 hours. Cardboard is 24 hours. And copper is 4 hours. So this means that when you get packages, you should be wiping them down and make sure you wash your hands. That's what that's all about. So the epidemiology characteristic of the virus is probably raised on other factors, including high viral loads in the upper respiratory tract and the potential for persons to be infected by the coronavirus that sheds transmission of the virus while asymptomatic. So this is why we have this new mandate that everyone, when you go outside, you should wear a mask, because you could be asymptomatic up to 48 hours. I think it might be a little longer than that, and you could still be spreading the virus. Now, since the virus can remain viral and infectious in aerosol for hours, surface up to days, depending on the shedding, the viral load is a measurement of how many viral particles the individual has in their system. Now, according to the CBEM, which is the Center of Evidence-Based Medicine webpage, healthcare workers are at a higher risk of getting COVID-19 and potentially being more severe due to multiple exposures, which can increase your viral loads, all the viral particles within your system. Healthcare workers are exposed more often due to numerous infected patients and exposures. In early stages of an outbreak, initial contacts might be recognized partly contact with those or with mild symptoms, or when you use protective measures in a subpar method, meaning not enough PPE, right? So PPE, this is the PPE. So personal protective equipment. When you have personal protective equipment, you need the N95 mask. This is the N95 mask. This is what they're saying to keep for the healthcare workers so you can be protected. This is 90%. That means 90% of whatever's out there in the air will not get into your nose or your mouth. That's why it's N95. There is N99 mask as well. Now, the surgical mask will not protect you from the COVID. It will not. This mask was developed basically to keep you from coughing and sneezing and contaminating others. So it will not protect you with the COVID-19 virus. We should not be using these, but I see a lot of nurses wearing these. This is not going to protect you. Also, you need to have a gown on. It's amazing how the other countries, they not only have gowns, but they have jumpsuits. And the jumpsuits cover the head all the way up to the neck and down. It covers everything. And we don't have that yet. I think some places do within the nursing, some ER parts, NICU, which is nurse intensive care units, they have it. You should have gargles for your eyes, protection for your eyes. Some new things that are coming out, they had a whole piece where you put it all on your head and it's protected. So that's it. And then also you have gloves. So everything is covered to protect you. That's the appropriate way you should be dressing when you're dealing with potential clients that may have COVID, or if they actually test positive. Our managers are not doing that yet. Not all of them. So that's what you need to protect yourself. Now, let's talk about the number of positive healthcare workers, because you know there is a lot of numbers, but no one's really keeping track of it. So I'm going to give you the numbers that I've been scouring across the internet to find for you. So what I have is in Italy, China, Indonesia, their total cases, this is for healthcare workers, 9,638. Deaths, they have a total of 92 medical doctors and 1 nurse practitioner. Now, I know there's got to be some nurses somewhere in that count, but I don't see any numbers that show what nurses have died. Now, none found at all in the U.S., but the total number of cases in the U.S. is 300,782. So if you take about 10% of that, that gets you to 30,978. And deaths, there's 8,444. 10% of that, 844. So we do know that there was a death, an RN that died on 3/25 in New York. The assistant nurse manager, his name is Keos Kelly. So we do know about that nurse death. So we only know about it when people are documenting. Now, per her peer, it was because of a lack of personal protective equipment. According to his PRN, the hospital has been having issues on low PPE for the majority of over a year. Completely not prepared. Nah, that's for normal times. So definitely they're not prepared for the pandemic. And that goes across all states. It's the same problem. Now, per Annie Lee, this is one of Keos' friends as well, she said that Keos was wearing a garbage bag. Nurses are, they're the most ingenious people to create things to do what they need to do to get through the day. So he used the garbage bag to use it as a gown cover so he can help sick patients. Now, I do know about a therapist that died with the sheriff department in LA County. Now, I wonder why they're not keeping those statistics, or how many healthcare workers are dying. We only heard about 2 on the internet. Now, I know there's a lot more. So I want you nurses to protect yourself. And we do have a right to protect ourselves. If there is, actually, let's talk about some PPE violations in LA County and Riverside County. This is in California. LA County is Los Angeles. So we have some violations. On 3/30, LAC USC in the ER. Sheriff Department Jail as well. Olive View. Harbor UCLA. Where the nurses were wearing surgical masks, meaning these, that are not going to protect you, only you from them, instead of the N95. Those are the violations. Okay? Now, they only want to provide the N95 for patients that are actually testing positive, patients who are in the ICU, intensive care unit, that are tested positive. Also, only will give you the N95 if you're doing an aerosol procedure. That leaves a lot of other patients and interaction and encounters for the nurses to be exposed. Now, a common practice is that RNs are not told when the patients test positive. They can be with that patient that day before or two, not wearing the right appropriate PPE, personal protective gear, then later find out somebody tested positive, but they don't tell the nurses who it was, so then they can self-quarantine, which is a terrible violation. Now, you can look on the screen, you can see what the appropriate PPE is. Even the ones in China where they're cleaning the subways and stuff, they're totally decked out in the appropriate PPE, and we're not. Now, also on April the 1st, the RN was scheduled in the intensive care unit in Olive View without having training in ICU. We can't have that. That risks safety to those patients. On 4/2, LSC USC RN was exposed to COVID-19 patients. Surgical mask and it didn't help her. Right? Of course, it's not going to help you. It's not the right mask. RNs use N95, gargles, gowns, face shields, and gloves, which I showed you. That's the proper thing that you should do. Now, shout out to 4A, the nurses in ICU, because they refused to work until they had the proper PPE. So shout out to you guys, and you guys stand up and refuse your assignment based on that. Now, DPH, Department of Public Health, they have the ability for their nurses to do total telework, meaning work from home. But they're instructing the nurses to go into the offices at least twice a week, and they're not providing any type of PPE recommendations at all. So we're supposed to social distancing, but they're instructing the nurses go into the office, which is inappropriate. It's dangerous. Now, according to Branton Harrell, nurses say they are not informed when they are exposed to an infected patient. Ross added, they are told to unsafely reuse masks, and at one hospital, they're even told that they're not supposed to wear a mask because it scares the patients. What kind of garbage is that? That is not appropriate. Healthcare workers must protect themselves and have all the proper PPE, meaning personal protective equipment, whether the patient is what they call a PUI, patient under investigation, meaning you're going through the process to be diagnosed, or COVID-19 positive. You have the right to refuse an assignment that is unsafe based on the lack of all required PPE, personal protective equipment, per Cal OSHA standards. You must have a single fit tested. You have to be tested to make sure it fits your face, to make sure you have at least 90% of the particles not entering into your face. Everybody's face is different. Also, based on the National Institute of Occupational Safety and Health standards for your safety, your patients, and community. Because if we're not protected and we're seeing all these patients we're passing on, what about our families? It gets passed on. That should stop. Nurses, stand up more. We had a couple of nurses that stood up, Black Girl Rock, and then another nurse in Chicago who resigned because they refused to take page. The microbiologist says no need to panic. Bathrooms and kitchen and areas are harbor the germs in the home. So keep those bathroom clean. We know we got to do that, right? But now you got to clean these packages. Now, you can use concentrated vinegar. Bleach is always good, right? Bleach is always good. Antibacterial soaps and sprays are always good as well. So remember I said the coronavirus stays on these packages. Also, mail, make sure you're washing your hands as well. It's in the mail because they said some people are actually spitting on the mail. So isn't that evil? We do have evil people in the world, so you have to protect yourself. Make sure you wash your hands. Now, here's another fact check. There's talk about ibuprofen versus Tylenol. And they said that ibuprofen can cause more serious respiratory problems than the Tylenol. Okay, there hasn't been much proof according to the experts, but they're investigating this. This is all new. Per Dr. Anthony Fauci, director of National Institute of Allergy and Infection Disease, he's the one that's always on the news with the updates with Trump. He says, I have not seen any data that indicates or disproves this fact. What he does know is that doctors tend to widely prescribe Tylenol because it's the best fever reliever. That's what he says. So we still need to wait to see what's going to come out regarding ibuprofen and what's going on with your symptoms. So I would say to you, have a discussion with your doctor. Make sure you don't stop your medication until you have a thorough discussion with your doctor. Your doctor may say, you know what, let's be safe. Let's put you on Tylenol. But have that conversation with your doctor. There's wonderful methods. You can call them, you can email them, and they respond right away. They also have tele appointments that you can have. Now, some reason why there's so many multiple failures in this world today, including with the pandemic. Per Albert Einstein, there's 3 great forces that rule the world. Stupidity, Trump, fear, greed, and also I think I want to add lies, lack of qualified real medical doctors in positions that should require MDs and not, they have them PhDs. Bad politicians that are unqualified, people in positions just because they know people and power and they want them in those positions. So we need more qualified people at the top. It's obvious the people that we have at the top is failing us because we're in a pandemic and we don't have adequate personal protective equipment. Per medium.com, this is disturbing for all healthcare workers. They are in shock and fear of retaliation to expose the risks that we and by consequences currently are facing. They're afraid to stand up because they're afraid of getting fired. It's time for the dirty secrets and inconvenient truth of what is really happening behind the scenes and come to light. Now, limit expectations in certain hospitals. Are letting staff wear protective equipment brought from home, and some aren't. If you bring your own personal equipment in, they won't let you work. Wow, that's puzzling. Also, employees their voices are drowned. They're drowning because they don't want to hear them because of the national shortage of personal protective equipment. So they don't want to hear what they have to say. Healthcare providers are sent out to the slaughter. COVID-19 is known to be airborne. China, Italy, and South Korea know it. The World Health Organization knows it. Studies conducted in America have shown it can be airborne for up to 3 hours. Our CDC knew it. They knew it was airborne at first, and then they downgraded it within 24 hours later to say it's not airborne, it's droplets, to reflect the national PPE shortage. Now, a few days later, CDC amended that recommendation, included bandanas and scarves as a result, but you can use that as an option. Other countries are having their healthcare workers, employees suit up in full hazmat gear, and other experts in infectious disease governance.org are offering organization recommendation for bandanas. So on 4/2, the Department of Public Health instructed everyone to wear a cloth covering when leaving your home. So it's very simple to make. I'm going to do it right quick. So you can just get a bandana or a piece of material, and then you fold it in half. And then you fold it over once. Depends on the size that you want. And then fold it back over again. And you add your rubber. These are rubber hair connectors, for us to put our hair up. Us women know what they're about. Or you can use rubber bands, large rubber bands. And then you just push one side into the other. And you push the other side over. And then you can straighten it a little bit. And then you put it on. And you have a mask. Right? You have a mask. Okay. So these are very easily made, and you can make them out of any material at all. And you'll have at least a covering for yourself to protect yourself when you go out into, when you need to get your groceries or you have to go out for your prescriptions or medical appointments, things that are absolutely necessary. They even have it where you can get your medications delivered straight to your home. So our leaders are not following with examples. They're refusing to wear cloth masks. They're refusing to maintain social distancing. We even had a leader that was sniffling. If you have symptoms, you should stay home. So our leaders need. Now the street cleaners in China, like I said before, they're completely darned, meaning have the whole personal protective equipment. And having the staff have the proper protective equipment. They fired him. And then when he got out on the media, they said, oh, no, we didn't fire him. We're just going to relocate him. Well, he didn't ask to be relocated. So thank you anyway for stepping up for your staff, Dr. Lynn. We really appreciate that. And thank you very much. And God bless you. Now, less ethical administrations are telling healthcare workers that it's a HIPAA violation to inform their patients if they're previously taken care of unprotected and they end up positive with the virus. This is untrue. It's not a HIPAA violation. This is negligent and criminally reckless. You should know if you were exposed. Now, if you don't want to give the name, that's fine. But you should let them know, hey, on this day, this time, you were exposed with a COVID-19 positive patient so that they can self-quarantine. That's what they need to do for 14 days, and it's not happening. Healthcare workers are instructed to wear the same mask for several days, the same mask across for all their patients. It's practically impossible to remove the mask and then reuse them without contaminating their cells. So when you're going from patient to patient, you're touching it. Eventually after a while, no one's perfect. You sweat, it's hot. You're going to rub your face. You're going to touch your nose, your mouth, your eyes, and boom, that's how you get tested positive. Many of the workers have been using, some of the administrators, they give them paper bags or plastic bags, and they instruct them to storm in a mask between shifts for a week or longer. The same mask, really? This is terrible. This is what's happening across the country. Now, how to take care of yourself when you're at home, especially the ones that are more vulnerable, the ones with heart disease, lung disease, diabetes, immunosuppressed, kidneys disorders, also hypertension, cardiac, and on and on. And don't forget about obesity. I want you to start working out and lose some weight because this is an increased risk factor for you too as well. So what you can do, because there's no real treatments at this time. Now they're kind of trying different things because when you're dying, you're willing to try anything because you need to try. So they're doing the hydroxychloroquine sulfate, Zitromax, and they're also trying this tocilizumab. They're trying that as well. It's a immunosuppressive drug for rheumatoid arthritis. So if I was dying, I would say, yeah, okay, try it because I want you to try to save my life. So these are some of the things. But right now, there's no real treatment designated at this time. Now, you can prevent exposure by keeping your social distancing. When you're out and about, some people still are invading your space. My husband tells me about this all the time, and you have to tell them to get back. Hey, speak up for yourself because that's your life. Tell them to get back, okay? Social distancing at least 6 feet or more. 6 feet or more, okay? Because when they sneeze or cough, then it can get you and it travels. Remember, it's in the air. I don't care what they say, it is in the air. It also happens when you exhale. Now, I mentioned this about 4 weeks ago when nobody was talking about it because why? I'm telling the truth. Yes, you can get it by talking and someone exhaling in front of you. So yes, you have to be careful. Now, another thing you can do is gargle every morning. You know, you can gargle every morning with mouthwash. I'm not supporting any type of brand, but you can gargle every morning. If you don't have the mouthwash, you can use warm water and salt. Warm everything is good to kill off that virus that's maybe lingering in your throat. You want to get rid of that. If it gets down into your GI tract, it's good because the acid will kill it. Now, you should always be washing your hands at least 20 seconds or more. If you're not sure you did it, then just keep going. It don't matter. As long as you do it at least 20 seconds. I'd rather do a little more than 2 less. So you want to make sure you get all in the grooves, all on the back. Make sure you get in your nails. Make sure you get all of that. Teach that with your kids. Practice that with them. Sing Twinkle, Twinkle, Little Star. Happy birthday ×2. Gloria Gaynor is also in there. Would I survive? I mean, there's many ways. So work with your kids and make it a fun thing while they're at home from school. Make sure you use soap and water, antibacterial soap. Now, if you're away and you don't have access to water and soap, you have to use a hand sanitizer at least 60 to 65% or higher. Anything lower than that is not going to help you. But make sure when you're using a hand sanitizer, you make sure you keep rubbing because that's what it's all about is friction until it dries. Don't put it on there, rub a little bit, and then wipe your hands on your clothes to dry it. Just keep rubbing until it dries so your hands are properly clean. Make sure you avoid touching your nose and your eyes. If you're sick, stay home. Stay away from people that are sick. I don't care about these excuses about allergies. Oh, it's my allergies. Stay away from me. If you're coughing, you're sneezing, stay away from me. I don't care. I don't want to hear nothing about your allergies. This is a whole different animal right now. We're talking about COVID-19. So I don't want to hear about your allergies. You're sick, stay away. People, especially people who are at high risk. Now, you have to make sure you wear your mask. And I showed you how you can do one very quickly. You can do it with T-shirts, any type of cloth you want, whatever it is to make it soft. I showed you how to do that. And you can do that in less than 45 seconds. Now, you want to also make sure that I wanted to let you know about is you must disinfect things that you come in contact every single day. Like you have to make sure you clean off your tables, your doorknobs, your light switches, countertops, handles, desks, phones, keyboard, toilet, especially in the toilet. Now, remember, I told you about the toilet. It's the dirtiest. The faucet, mail, money even. Money. When you're out, and someone give it to you, you can have your gloves on and put it in the bag. And when you get home, you can wash it. Yeah, I tried it. And I remember that from the gangster movies because they used to wash it. So I tried it and it did work. So you can wash your money. Okay? And your things like your keys you don't think about. You need to clean those things every day. So those are some of the things that you can do. And make sure if you're thinking about different disinfectant, you use your bleach. You can make it. Don't forget about your cell phone. We use that. They say we touch it about 250 times a day. So make sure you're cleaning that off too. Also, you can make your own bleach. You can get a plastic container and you can use 5 tablespoons or 1/3 cup of bleach per gallon of water or 4 teaspoons of bleach per quart of water, following whatever manufacturer guidelines are. Now, you want to make sure that you never mix bleach with ammonia. Never. because that's a terrible chemical. It can burn your eyes and your nose. It smokes. Never mix chemicals, ever, ever, especially with ammonia. Never do that. Make sure you don't use expired disinfectants, bleaches, and stuff like that. It's not going to be effective. There's some alcohols that, at least 70%. If you don't have the bleach, you can use alcohol. You can also go on to this website for the EPA registered household disinfectant products to view their standards, so then you can make sure that you have a product that's good for you. Now, a lot of companies are making that antibacterial soap, and you have to be careful. You need to read the ingredients, because some people are getting burnt from using those products. So you have to be careful. Read the ingredients before you buy this stuff online. People are taking advantage of our misery and our desperation, and they're giving us the wrong products. So make sure you follow those instructions. Now, drink plenty of fluids. You want to make sure that you're drinking fluids. Make sure you stay hydrated. You don't want your throat to stay dry. Another thing I use my NedMed rinse, where you can put a package in there and you put it in your nostril, and it should, with warm water, and you hold your face over the sink and it comes out through the nostril, so it cleans your sinuses out and your nose out. And you do the same thing with the other side, and it helps to clean you out. And boy, after I use this, I'm really blowing my nose, so it does work. So you might want to do that. Also, make sure you follow the instructions on cleaning them. There's instructions. You clean it with soap and water, and then you let it dry, and then you can use it every day. Make sure you're not trying to make your own packs and put it through your nose, because then too much sodium or sodium bicarbonate can cause your nose to swell, and you don't need extra problems. So don't be trying to be whiffy and make your own products. Follow the instructions, okay? Now, the other thing you can do is nutritional foods. You want to make sure that you eat foods that are rich in zinc. Like you have your blackberries, your broccoli. There's also avocados. There's cashews, almonds. All of these things are rich in zinc. This helps to build your immune system. There's sweet potatoes, also radishes, crabs, pumpkin seeds. This helps to increase your sense of smell. It helps for building proteins, triggering enzymes, and creating DNA. Help you keep building DNA and your neurotransmitters. That's what we need every day. So you can eat those type of foods as well. And you can also eat foods that have a higher pH. The coronavirus usually lives in environments that are 5.5 to 8.5. So things that are higher than that are things like lemons. Avocados just good all around, right? It's good for zinc. It's also good for the pH level. So that's good for that. You can also eat garlic, mangoes, tangerines, pineapples, dandelions. I never had that before. It's a flower, but some people use it in herbs to cook with and different things. And also oranges. Oranges are good. So these have acid in them. So that's why those would be good for that. Get plenty of rest. And remember, if you don't get rest, you can't let your immune system reboot. So we beat our body up all day. So that's why we have to get plenty of sleep. Make sure it's uninterrupted sleep. So if you're having problems sleeping, notify your doctor so you can have a discussion to see what it is. If you exercise before you go to bed, for me, when I'm stressed, I exercise, I go to sleep easier. You might need to get some melatonin. When I'm totally frustrated, I take melatonin to help me naturally go to sleep. So there's different things you can do. But you want to make sure you have that good uninterrupted sleep, because that's when your body reboots. So you need that as well. Gotta get sleep. Now, like I said, exercise is good for you anyway. The body is designed to move. Normally in my shows, I'll do like exercises at the end of the show. There's a show last week where I did do demonstration of exercise that you can do while you're lying, sitting, or standing. So there's no reason to not exercise. You can exercise every single day. If you're watching one of your favorite shows, then you know that's an hour. That means you didn't exercise for a whole hour. So watch my show from last week and go to the end of the show, and you can see some of the exercises that I actually demonstrated for you. Exercise is very important. So make sure you do that every day. At least 45 minutes to an hour. With your kids home, they like to exercise too. You just got to get into a routine. Either get a show on and watch it or turn on some music. It'll be great. Now, also, did you guys see how Captain Crozer, they released him from duty from the USS, I forget the name of the ship now, but because he was concerned about his men, because some were getting sick with COVID-19. So they relieved him of his duty, which is so sick. I just think that is really terrible. When people speak up against the injustice or the need for people to improve how they care for their workers or their employees, then they get bullied, or they get relieved, or they reassign them, or it's just ridiculous. This is a time of crisis. You need doctors, you need nurses. So why are you beating up your staff that is going to be the one that's going to take care of you? That makes no sense. Now, there should be respiratory protection. It's mandatory for healthcare employees. Mandatory. So this means that nurses and doctors should not have to fight to be protected. This is an airborne infectious disease. It's a new pathogen. It's similar because it's in the family of the coronavirus, but it's still new because this is a different type. But it is still airborne. So everyone needs to be safe, and they need to prevent harmful exposures to protect their workers, their families, their community. Therefore, employees must provide appropriate respiratory protection for all times when other controls don't eliminate employees' exposure to airborne infectious disease. Like I had mentioned earlier, you need to have the N95 respirator because it prevents 95% of airborne particles from getting to you. And as I stated, there's masks there's N99, which are even better, right? But we need to have at least N95, okay? Okay. Now, the U.S. National Institute of Occupational Safety also recommends this. So does Cal OSHA, which I told you about earlier. Now, in their interim guidelines provide employees and workers in health settings, there's sometimes, there's going to be, we have a respiratory shortage, right? So you have to make sure you protect the N95 respirators as much as possible. So people who don't need to have contact with that patient should not be dealing with that patient in order to reserve the N95 respirators. And I understand that should happen. Also, there's some scandalous people where some people are just taking all the masks. Why are you doing this? No, leave them for the healthcare workers, because if you were sick, you would want that person to take care of you. So why are you taking the mask? All of our personal protective equipment, people took it, hoarding it, and trying to charge all these outrageous prices because they know we need them now. Please change your heart and give those items to the healthcare workers. According to Dr. Maria van Kerkhove on 316 and 323, the head of WHO, which is the World Health Organization, COVID-19 spreads through human-to-human contact droplets carried through sneezing, coughing, and germs left on inanimate objects. The COVID-19 goes through the air, it's airborne, stands suspended in the air depending on the factors such as heat and humidity. Management supplies disposable N95 mask respirators can be depleted with any pandemic, widespread outbreaks, other infectious illness, and otherwise high demand. Healthcare facilities should plan to stockpile respirators and conserve them, utilizing them to supply while properly protecting their employees from exposure. So this is what our managers should have did, and they didn't do. State and local public health departments can help provide respirators to healthcare facilities who have low inventory and experience difficulty in getting orders filled. However, supplies may be limited to the supply chain may be interrupted. So this is why our management team should have stockpiled enough personal protective equipment so if this happens, we can respond. As you can see, we're well under what we're supposed to have. We don't have enough personal protective equipment. There is a shortage. We don't even have enough ventilators. And everyone on those floors need to be protected, whether it's the nurses, the doctors, the clerks, the environmental workers, the one who are cleaning up. Everybody in that area should have it. And as you see, when the producer put the N95, the protective equipment with the full suit, jumpsuits, the visors, the goggles, the N95, and the gloves, that's what you should have on when you're dealing with this. But we don't have that. And it's very short demand. Why? Because our leaders didn't follow through to make sure we had enough protective equipment required in the stockpile. So that's what happened. We also have, there's another option where there is a reusable device called a powered air purifying respirator. That one can be disinfected and reused. But there's a whole process you have to follow, and I think it usually takes about 30 minutes in between when the staff can actually use them. I don't know how many we have. Our facilities, I haven't heard about that. So you guys, if we do have them, give me a shout out, and I can put it on the next show. Now, so those are some of the things that we can use, that we can reuse effectively and be safe. Now, extended use of the filtering respirators, extended to respirators occur. Healthcare workers help the try to use those. Several patients, sometimes if they're in the same room and they're like all together, they say you can use it, you're in the same space. I just don't recommend that, but they said you can. Now, risk of extended use and reuse of respirators. The risk. Some devices have not been FDA cleared, meaning that they're not really good for that. So you can't do that. Product users instructions recommended discard after each single use. That's for the N95. They're not really recommended for reuse. They recommend it for one single use. The most efficient risk in contact transmission from touching the surface, contaminating the respirator. One has found that nurses, in the average, you touch this mask at least 25 times per shift to your face, eyes. They're here, right? So you're touching your eyes, your nose, your mouth, because you know this. You sweat in these suits, so you get hot. So if you keep reusing it, every time you take it off, you're just infecting yourself and giving yourself more chances of exposure. So you touch it at least 25 times, at least. This is proven research. Contact transmission occurs through direct contact with others as well as through indirect contact by touching and contaminating surfaces that are then touched by other people. Respiratory pathogens on the respirator surface can potentially be transferred and touched to the wearer's hands. Risk of causing infection through subsequent touching, mucous membranes of the face. So you're infecting yourself because you're reusing it. So that's why they recommend a one-time only use. So you don't do that. There is, like I said, there's a N99 as well that has 99% chance of decreased particles that you will be able to be exposed to. Now, there is a shortage of the N95. We know that. So we're all underprepared. So now we have to still protect ourselves, nurses. You have to protect yourself. You have to be properly trained. If you're not used to using the N95 mask and donning and undonning, doffing your personal protective equipment. You should be trained. You should be fit tested. Yes, including the housekeepers. They should be fit tested. This is the way it should be done. Everyone should be tested. Everyone should be tested for the proper N95 fit test respirator. Not a mask, it's a respirator. There's a big difference. Now, sometimes to decrease or preserve the supply, you want to make sure, like I said, no one should be coming to the floor or using the equipment or seeing that patient that should not be seen by that particular person should not be on the floor. Now, per ATD, meaning aerosol transmitted disease standards, require that every employee use feasible engineering and administrative controls to protect employees from airborne infectious disease, as listed in the Appendix A, Title 8, Section 5199. This is your protection, nurses. These controls are required to protect individuals from the COVID-19 and can also help employees conserve their respirator supply as follows. Using engineering control, limit the number of employees who have contact with the COVID-19 patient to reduce the need for respirators. Isolation known or suspected COVID cases, airborne infection isolation rooms in those areas are feasible, and they should not be used unless they're in those areas. So those are other barriers that administration can do. Even though there may be a protective barrier shield there, it's not total protection from the coronavirus. It is just a little bit of a barrier, but it's not total protection. So don't think that that's going to give you total protection, because it's not. Now, I want to go back to taking care of yourself. So, what you should do, nurses, healthcare workers, we should be the priority. And it's very important that if you're assigned to a PUI, person under investigation for the COVID-19, or persons positive for the COVID-19, or especially if there's aerosol with the COVID-19, you should have all your proper PPE. And if you don't have it, you have the right under Cal OSHA to state that, because it's not for your safety. It's definitely not for your family's safety, and it's not for the safety of all those patients and other people you come in contact with, because some people are asymptomatic. So I'm going to show you again how to make a mask. We have a new directive that came out that now they're finally understanding that this is aerosol and you can get it through talking and exhaling. So now there's a new directive, because people are still able to transmit the COVID-19 virus by talking and exhaling, and they know it's in the air. Okay, they do know it. They've known it for months. So you can take any type of cloth, right? You fold it in half, depending on how big you want it. And then you take one, you fold it over again, and you fold it one more time, right? So it looks like this, depending on how big you want it. And then you take, these are just regular elastic bands for your hair, and you put it over each end, move it up about a quarter way, third of the way on each end, right? And then you can put one side in under the one rubber band, and you straighten it out a little bit, right? And then you put it over the other one. And depending on the size of it, you straighten it out, right? And then you grab the two rubber bands and you put it on. Put it over your ears, right? So now you have a protected mask. And this one is pretty snug. I actually like this one. It's pretty snug. So you can make it according to what you want, and you can wear this, and it's washable. So when you go out, you don't have to reuse these, because you can just wash them, because they're cloth masks, right? So you can do that. Now, Make sure you be mindful that you don't overeat or stress eat. People tend to eat too fast. When you eat too fast, you eat too much. So you want to make sure that you slow down and you're not eating too fast. If you know that's your habit, then drink a glass of water, a whole glass of water before you eat. That way you won't overeat as much. And if your kids are eating too fast, slow them down. Sit with your kids. You guys sit together and start eating and finishing together to ensure that your kids are eating the proper portions and slowing them down, and you slow down as well. Make sure you're eating the zinc-enriched products to increase your immune system, like the blackberries, the broccoli, the almonds, the cashew nuts, the avocados. Make sure you're eating those type of things to build your immune system, which is zinc. Those are zinc products. And if you're having a hard time getting the products, you can also have zinc supplements. You can also make sure you're increasing the use of acid products to increase the pH, because coronavirus is 5.5 to 8.5. So you want to eat things like lemons, avocados. Again, it's just the best little vegetable, right? Then you want to eat oranges. There's mango, pineapples, different ones that you can eat to help protect yourself. You want to eat warm fluids at dinner time or at meal time, because that helps to get rid of the gut junk that's in your throat. The coronavirus cannot last in your gut because of the acid in your stomach, because of hydrochloric acid. You want to gargle every day, which is good. Make sure you're cleaning everything, including your money. Keep 6 feet social distance. If no one's keeping it, push them back. That's your right. Social distancing. If you don't have to go out, stay in. Young people, stay in. You get it too, and you're dying too. So it's not just the older people, it's everybody. So keep your social distance and wash your hands for at least 20 seconds or more. Okay, so next week, I'm not sure if I do a show next week or not, because I am having my surgery on my knee. So I'll let you know. I'll keep you in contact. If you want to contact me, you can go to marquita.com. If anybody missed a show, have them go there, click previous show. They can watch it anytime. Have your friends and your family watch. And if you need to contact me, you can send me a message at marquita.com or healthyliving.company. You can also reach me here at the Next Level Studios at 310-549-1113, 310-549-1113. And the producer of the show is T Jams, TJAMZ. You can reach him at tjamsmusic.com. He writes all the music you hear for the song, to the shows. You can go there. You can write lyrics, send him messages. He also does web design. You can also reach him here at the Next Level Studios at 310-549-1113. And then be safe. Don't go out unless absolutely necessary. Talk to your doctor if you need to consult about anything medical, about the ibuprofen, whatever it may be. When you're getting symptoms, contact your doctor. Don't go to drive up until you talk to your doctor first, because they will turn you away. For right now that I know of, you have to have a prescription. It has to be approved. Don't pay for any COVID testing or treatment. If so, keep your bills and send it to your medical insurance, because they should not be charging you. Okay, until the next time, stay safe, keep that social distancing, wash those hands. Take yourself, wash those hands. Hey, nurses. Hey, doctors. Stay safe. Hey, stay safe. Stay safe. Stay safe. We matter. We should be priority. Don't matter if you're rich or poor. Nurses, workers.